Now the last one down here, IFIS. This is something that's really come in to the media and to the literature over the last several years. The IFIS is Intraoperative Floppy Iris Syndrome, and you need to know about this. It is a possible complication during cataract surgery. Alpha blockers are located not just in the prostate, they're located elsewhere in the body. One of them is the constrictor muscle of the iris, the muscle that constricts the iris. If you block that muscle, I'm sorry, the dilator muscle within the iris. If you block that muscle, it can't dilate, it will remain constricted. So the muscle that constricts is unopposed. If you're having surgery on your eye, you want that dilated, so that's a problem for the ophthalmologist. All they need to know is that you've been on it or that you're on it, because they can take precautions and take steps intraoperatively to counteract that. But if they don't know that's a problem, it can be problems intraoperatively. So if you're on it, definitely tell them. Some data even says even if you were on it for a period of time 10 years ago, it still may be an issue, therefore you should tell the doctor, the ophthalmologist about it. Now the second group of medications, the 5-alpha reductase inhibitors, this is the Proscar and the Avodart. This not only does symptoms but also prevents progression of events. Again, the urinary retention and the need for surgical intervention. And again, because it decreases the stroma. So you go from here back to here again. Sort of decreases the size of the prostate. Okay. It is most effective with large prostates, usually over 40 cc's or 40 grams and over. It doesn't do a whole lot of good for prostates under that. Unfortunately, it takes a long time to set in, at least 6 months. So it's a commitment. You have to know going in, I'm going to take this med for at least 6 months before I may see anything, maybe even up to a year. Okay? As opposed to the other one, which is a short acting. The other thing you need to know is it decreases your PSA value by a half after about 6 months. So if you're having your PSAs followed and you start this medication and you see a drop in your PSA around 6 months, that's not, it's due to the medication. So if you're on one of those meds, you really need to double your PSA for the real number. Okay. This also has side effects.
It's not half a point, it cuts it in
half. So if it was 8, it becomes 4. So if you come in and you're on Avodart and I get a PSA on you and you're at 4 and you say, great, I'm under the threshold. So, well, you're on Proscar, it's actually 8.
Yeah.
You need a biopsy. Okay. So side effects like any med, this gynecomastia is enlargement of the breast, decreased libido, you can get erectile dysfunction, decreased volume of your ejaculate as well. Both, like you said, both work well. They actually work better when they're combined, more than either one alone. So they actually have a synergistic improvement in your symptoms, in your scores. And the classic paper, the study that described this was the MTOPS Trial, Medical Therapy of Prostate Symptoms. Over 3,000 men, age 50 and over, randomized to either the doxazosin, which is the alpha blocker, the finasteride, which is the 5-alpha reductase inhibitor, both combined, or a placebo, which is nothing, or a fake pill. They followed it for 4.5 years, and they found that both the alpha blockers and the 5-alpha reductase inhibitors inhibited symptom progression of BPH, so it helped with the symptoms.
Is finasteride the same as Proscar?
Yes. But they also found that combo therapy actually prevented progression, but even better. Now, really only for the larger prostates, though. That really only played the role. The alpha blockers by themselves decreased symptoms by 39%. The 5-alpha reductase meds decreased that by 34%, but also decreased the retention and need for surgery as well. But the combo did an even better job.
Does it reduce the side effects of each? I mean, you know, like, do you use less of each medication when you put them? Okay, so you still, and you double the possible side effects.
Well, I don't know about double, but you add the other medication side effects.
Yeah, that's what I'm talking about.
Now, this is just a graph of the acute urinary retention, and you can see the placebo up top. This is the alpha blocker here, the 5-alpha reductase, and the combo therapy. So it really does have an effect on the retention. Now, the anticholinergics. This is the ones that treat the bladder, the hyperactivity of the bladder. It reduces bladder spasms and relaxes the bladder. again, side effects, constipation, dry mouth. It can cause mental status changes as well, okay? Especially in the elderly, so you have to be careful. Herbal medication. This is another extremely controversial topic, and we could give a 10-hour presentation on this. There's sort of a list of some more of the popular ones up top. Unfortunately, the majority, if not all, the studies are not quality studies, meaning level 1 evidence. And we'll go into that a little bit. But I get this asked almost daily. What do you think about this? What do you think about herbal meds? And really the bottom line is it may help and it probably is safe. But the converse to that is it may not help and it may not be safe. Okay, so really you just sort of have to be careful with that.
What about mushrooms and selenium? Are they?
We'll talk about that. We'll talk about that. Good question.
What about cranberries, cranberry juice?
Cranberry juice?
Yes, and cranberries, they talk about that.
Again, all that data, all that herbal supplement, there is data that supports it. Is it good data? Or not great data. There is some data that says it helps prevent urinary tract infections. There's always some study that says it may help with prostate cancer or reduce the risk of BPH or prostate cancer. But is it are they large studies? Is it placebo controlled? Level 1 evidence? The majority, if not all of it's no. Doesn't mean it doesn't work, but it just hasn't really good evidence to prove that it does.
That's all it doesn't do, quality study.
It's hard. They have tried. You need thousands and thousands of people. You need placebos. You need the problem, especially with prostate cancer, is the end result is death from prostate cancer. There are some surrogate answers in between, like elevating your PSA, that sort of stuff. But it takes years and years to do it. There's so many variables that go into it. There are some studies that are better than others that have tried to do it, and we'll talk about a couple of those. Obviously, the herbal supplements, it's a billion-dollar industry. This is all over the news. In 2010, there were 54,000 recorded in the Natural Medicine Comprehensive Database, but only a third of them had any level of evidence to support what they do. I don't know if you can see this, but I just entered Palmetto and BPH, and it came out as 432,000 hits. So, this is looked into a lot. You think, well, this has been around for thousands of years. It has to have some validity to it. And I agree. I say something must be going on. It's been around from the Greeks to the Chinese. Something must be happening. It can't last that long without some truth to it. The saw palmetto is probably the most common one that we hear about and that we talk about. This has been proven that to inhibit the conversion of testosterone to dihydrotestosterone, so acts a lot like the Proscar or the Avodart. There are some studies that are randomized. Again, they're trying to kind of do this level 1 evidence. There have been some that show improvements in some of the symptoms. All in all, though, the AUA guidelines panel just came out last month, so hot off the press. Quote, not recommended. It may help, but not recommended just because we don't know. There's not enough evidence to support it. Okay. Again, you want large, randomized, placebo-controlled trials. They just don't exist. It's hard to do. A lot of these mechanisms of actions are unknown. The placebo effect is a key contributor in all medications. And herbal medications is probably no different. Okay? There's some studies that show that 30% of improvement is just due to placebo. I hand you a salt pill and say this will help you, and you think it helps you 30% of the time.